Hi, myself Dr. Kailash, consulting dermatologist and medical director of Clear Skin Hair and Layer Center, Kurnool. Today we are going to discuss about alopecia areata, also known as patchy hair loss or spot baldness. Alopecia areata is a common chronic nose-carrying alopecia that occurs in small patches of hair loss in one or more areas of the body, which can be initially unnoticed. It develops when the immune system attacks the hair follicles, resulting in hair loss. While the disease is not medically serious, it can have a psychological impact on people. Who can get alopecia areata? It can affect anyone. It affects both men and women equally, and it affects all racial and ethnic groups. The onset can occur at any age, but it is common in people in their teens or 20s or 30s. When it occurs in children under the age of 10, it is more extensive and progressive. Causes of alopecia areata. Alopecia areata is an autoimmune disease, which means that your own immune system overreacts and attacks your own cells. Immune cells, which are supposed to protect our bodies from foreign bodies, cause damage to our own cells. The affected areas of hair follicles are attacked by immune cells, causing disruption of hair follicles, which leads to weakening of hair roots and stoppage of hair production, resulting in hair loss. The precise cause of origin is unknown, but possible triggers such as infection, medication, environmental factors, and extreme abrupt stress could cause the body immune system to overreact. According to medical studies, few causes are listed below. 10 to 25% of patients have family history of alopecia areata and or other autoimmune diseases such as type 1 diabetes or rheumatoid arthritis. Alopecia areata patients have higher than expected rate of thyroid disease, vitiligo and atopic eczema. Third is patients with chromosomal disorders such as Down's disease have a higher prevalence rate. It is possible that it is a drug-induced when it occurs in patients taking biological medications. Types of alopecia areata. Types of alopecia areata depends upon their symptoms, extent of hair loss, prognosis, and also varying treatment. Alopecia areata or patchy alopecia is a classical and usual type of alopecia areata with one or more coin-sized patchy hair loss, often involving the scalp and or face. It can progress to surrounding area to become alopecia totalis or universalis. Second is diffuse alopecia areata. The presentation is similar to male or female pattern hair loss, where there is sudden diffuse thinning of the hair over the entire scalp, unlike classical patchy hair loss of alopecia areata. Uffiasis pattern of alopecia areata is a form of alopecia areata distinguished by snake-shaped like hair loss involving the circumference of the head or at the margins of sides and lower back. Alopecia totalis, hair loss involving the entire scalp. Alopecia universalis, hair loss involving the entire body. Here the hair loss involves the scalp as well as the facial hair including eyebrows, eyelashes, with possibility of involving body hair such as chest, back, extremities and pubic area. Treatment. Currently, there is no universal treatment guidelines available for every patient of alopecia areata, as some treatments are effective for some patients. The treatment depends on the type of alopecia areata, age and extent of hair loss, as there are different treatment options available. The main goal of treatment is to suppress the immune system attack and stimulate hair growth. Topical medications are useful if we have a limited alopecia areata, such as corticosteroid, which works by reducing the inflammation in the hair follicle. Topical minoxidil, available in 2 strengths, 5 and 2%, can be applied twice daily to the affected area. It is relatively safe and used in conjunction with steroid cream and not responding to topical steroid alone. Topical anthralin works by irritating the skin and stimulate hair growth. Topical immunotherapy, in which a chemical difencifron is applied to the skin may induce an allergic reaction and induces hair regrowth. It may need to be continued even after to maintain the hair regrowth. Intralesional injections. If a localized or limited patch of alopecia is not responding to topical treatment, or if a quick response is required, intralesional injections or steroid injections are used. The treatment is recommended for every 1 to 2 months. Oral treatments. Oral immunosuppressive drugs such as cortisone tablets are sometimes used for extensive alopecia. Oral immunomodulators like methotrexate, azathioprine and cyclosporine are another option and work by blocking the immune system. Phototherapy or light therapy. Targeted phototherapy or 308 eczema are opted for localized or limited alopecia areata and for the recalcitrant to the treatment mentioned above. Conventional whole body narrow band UV therapy or UVA, that is Sorless plus UVA, called photochemotherapy for hair loss involving extensive areas of the body such as alopecia universalis or alopecia totalis with other parts of the body. Interventional treatment such as mesotherapy, dermaroller, low-level laser therapy or platelet-rich plasma in addition to medical treatment can help in treating alopecia areata. Conclusion. However, alopecia areata does not cause any physical pain, but it causes emotional or psychological pain, especially when it affects the whole scalp or if it involves the face like eyebrows. The patient feels more isolated and become depressed. To combat this situation, counseling and change in lifestyle play an important role. Treatment which can change the lifestyle are such for completely bald hair, eyebrow pencils or stencils, microblading, eyebrow tattoo or eyelash extension.